If you wanted to create the most innovative environment in the world, what would it look like? Henry Ford felt the best way to do this was to bring everyone together, put them on equal footing, and give them the tools to be great. For 100 years, this crucible of incredible minds has changed medicine in amazing ways. From Conrad Lamb and the invention of the heart-lung machine to Money Menon with robotic surgery. The environment that helped foster the innovative enterprise of these pioneers was critical to the development of these achievements. Because of the output of medical advancements over the last 100 years, today, Henry Ford Hospital is a name known around the world.
Innovation is how you energize and you bring new ideas, which bring new revenues, so, new ways. It also excites people, charges them up about doing something. Otherwise, it becomes every day doing the same thing. So satellites were innovation, HMO was innovation, home healthcare was innovation. Doing all these is exciting. Everybody takes pride in doing something else.
Henry Ford's fundamental philosophy was to get the best doctors he could, give them the best technology they could, and let them run with that. This is how he got Frank Sladen to be the first chairman of medicine, Roy McClure to be the first chairman of surgery. And he wanted everyone to work together. He wanted it to go to the patients. And this was far-sighted. This was at a time when 99% of doctors were mom and pop shops. They were individualists and they just practiced by themselves. They didn't communicate, they didn't team together. But Henry Ford forced that upon the medical world in Detroit by the sheer force of his personality.
At many academic institutions, it's the department and you have to go up the silo and down the silo before you get to talk to anyone else, or if you have an idea. And here it was so nice that I could walk 20 feet to go talk to the primary care physician that was taking care of the patient. I could go talk to general surgery, I could go talk to vascular, I could go up and talk to urology, and it didn't seem like it had the same constraints that a lot of other organizations did.
That partnership is a model that isn't often duplicated, where we have the crosswalk between the clinical side of the organization and the administrative side of the organization. Each group embodies the values of the others, and they are at equal levels. So we've got a physician-led organization with administrative supports, but everybody's a servant leader. They kind of are organized around making it possible for the people who are doing the work to do their work at the top of their training and with the greatest efficiency.
We don't want status quo folks here in that. We want folks to always look at how to do things better. And I think that that's hugely attractive to healthcare providers.
Well, I feel that I have a duty to represent the medical group. And I think that once that becomes part of your thinking, I think it gives you a certain responsibility, so that every patient that you see, they think about Henry Ford. We all walk around with that concept that we want to be the next Dr. Lamb or the next Dr. Ernst or Dr. Zalagi, who was pioneers in vascular surgery. So I think that having been exposed to people like that throughout your career and realize that you just can't be average, I think that's, at least that's what I carry myself as a Henry Ford physician.